Happy Friday and Happy New Year. I apologize if there are any fireworks that you hear in the background. So today I'm going to be talking about stretch marks. What are they? How do you get them? How do you treat them? What causes them? Everything about stretch marks. So basically, first I'm going to go over the layers of the skin. So you have the epidermis, which is your skin's like protective layer, the very topmost layer. Then you have your dermis, and that contains the proteins like collagen and elastin. And elastin helps your skin regain its shape and form after you have weight fluctuations. So if you rapidly gain weight, then that can lead to stretch marks, versus if it's a slow, gradual process of gaining weight, either in pregnancy or just in regular life, then your skin, the collagen and elastin can accommodate. But if it's too quick of weight gain or muscle gain, then stretch marks can develop. A lot of it also has to do with hereditary factors. So, you know, if you have family members who have stretch marks, then that might also predispose you to have stretch marks. Or if you have certain medical conditions, then that can also predispose you to get stretch marks. So when this dermis layer, which has the collagen and the elastin, when it's overburdened with rapid weight gain with pregnancy or weight gain or whatnot, then the dermis can actually tear because that connective tissue just can't accommodate fast enough to reconfigure itself as the body, as the skin is stretching. So what happens then is that the tears, you can kind of like see through. That's why it's kind of like a glassy appearance. So underneath you see the hypodermis, which is basically like the subcutaneous fatty layer of your body. So once you get a stretch mark, there's no way that you can reverse it. Like, that skin is damaged. It's always going to be damaged. And the only thing you can do is to try to conceal it, either with like tanning lotions. You can try some laser treatments, some chemical peels can help lessen the appearance of the stretch mark, but nothing is going to actually remove the stretch mark or get rid of it other than cutting it out. So, so that's the main treatment of stretch marks, especially like on the body, is just actually excising it, removing it. That is the only treatment of stretch marks, how to get rid of it, because that skin is already damaged and you can't, it's irreparable. Not to worry, stretch marks are not dangerous in any form or fashion, but they can be really, you know, disheartening and, can make a lot of patients feel very uncomfortable and self-conscious. So, but that's why there are plastic surgeons around, and we can help you, you know, remove these stretch marks in a safe manner. And you can get stretch marks anywhere on the skin. A lot of times it happens on the belly or on your hips and thighs, and you can also get stretch marks on your arms. But regardless where they are, just talk to your plastic surgeon about, or your dermatologist, you know, what can be done about the stretch marks. Often dermatologists can help provide some treatments that help conceal the stretch marks a little bit. But like I said, the only real way to get rid of them is to cut them out. So I hope this helps answer some of your questions on stretch marks. The one last thing I will say is that there are no good studies out there that show high-level evidence that there's anything you can do to prevent stretch marks. Once they start to appear, there's some very low-level evidence that hyaluronic acid can help decrease the appearance of stretch marks or help decrease them forming. But that's very low level of evidence. Also, tretinoin can also possibly decrease the appearance or, you know, how stretch marks develop. But tretinoin is something that you don't want to be taking when you are pregnant. And a lot of times these stretch marks develop during the course of pregnancy. But yeah, no famous lotions, potions, cocoa butter, vitamin E oil, olive oil. There's nothing really that can help you from preventing to get stretch marks, like I said. So anyways, I hope you have a happy new year, and I hope this clears up some questions that you have may have regarding stretch marks. If you have any other questions, just comment down below and I'll help to address them. All right, happy new year.